Welcome, everyone, to the 2024 AMSSM pre-meeting kickoff. This is going to be the AMSSM Top Article Project. I am Dr. Lee Mancini, one of the co-chairs, and you'll be hearing from myself and my other co-chair, Dr. Bob Baker, later on. We have nothing to disclose. What we're going to be talking about tonight is a pre-conference kickoff, show you the changes we made from our top article project from last year, briefly learn how we picked this year's top articles, and then we're going to reveal the honorable mention top articles in sports and exercise medicine from 2023, and you'll learn how you can join our subcommittee. So first, I want to recognize all the hard work that went on this past year, pulling and compiling our top articles. We actually had 8 new members this upcoming year who joined our group. So I wanted to highlight them as well as the returning members, which you can see here in black. As most people may recall, or if you're new to our group, we have 2 groups within our subcommittee, our core journal article group and our keyword hot topic group. In the first year in 2020 that we did this project, we only pulled 4 journal indices in our core journals. In 2021, we expanded and added 10 more journals to have a total of 14. In 2022, we added another 12 journals to bring it up to 26. That meant that our entire group was going through the indices every single issue throughout the entire calendar year to pull any interesting or important articles. This year, we actually removed Nature and we removed Science because last year we felt they were low yield. So this year in 2023, we pulled from 24 journals in total. From the keywords hot topics, we searched in 2022 these 16 different topics. This year, we added 3 new additions: shared decision-making, return to play, sports medicine ethics and regulations, and nerve entrapment, in addition to the previous 16 keyword hot topics. So in this aspect of our group, we searched by keyword all of these words to pull any important articles. Our algorithm stayed the same, which was 5 different criteria. Change your practice or practice affirming was 40% of an article's rating. Level of evidence or the quality of the study was 30%, relevance to current issues 10%, breadth of applicability across sports medicine 10%, relevance to primary care sports medicine 10%. So again, for change your practice or practice affirming, all of these were scored on a scale of 1 to 10. But the idea when you were reading and scoring on this aspect was to imagine if you were a person who did not do this in your practice, whatever the article was talking about, a new intervention, a new treatment modality, and then you read this article, how likely would you be to adopt this practice? So 10 would be yes, very likely or strongly affirming, or definitely I would change my practice based on this article, or 1 not likely at all. Relevance to current issues was 10%. These were topics in the media that were buzzword-worthy. Things in this past year, things like care for the transgendered athlete, orthobiologics, or number 1 would be a topic not being talked about. So there was a subjective component with this 10%. So something like COVID, that when we first started in 2020 with this project, might have ranked higher up on the list. As we've gotten further and further away from the pandemic, maybe not much as relevant to current issues. Breadth of applicability across sports medicine was 10%. And the point would be someone reading the article would think about how this applies to everyone who practices sports medicine, just not their own personal practice, and think about how it applied to all of sports medicine patients. So 10 would have a very wide applicability, 1 would be very narrow. So for example, if you had an article on professional baseball players with UCL injuries who were playing in Japan, that's a narrower scope than an article that would deal with all sorts of concussions. Or if you have an article on bone health for people over the age of 60 versus an article on bone health for people over the age of 20. 20 and up is going to have a greater scale and a greater applicability than people just over the age of 60. And last, if you had an article that was just looking at professional female soccer players with ACL tears, that's a narrow breadth of applicability versus an article on all female athletes with ACL tears. And then the last category in our algorithm was relevance to primary care sports medicine, which was also 10%. How the article applies to those of us who practice primary care sports medicine versus orthopedic sports medicine. So again, we wanted to rate this section based on not on our own personal practice, but the whole of primary care sports medicine. So 10 would be very relevant and 1 would be not very relevant at all. So again, example, an article on a new type of ORIF hardware for tibial fractures would not be as applicable as an article on a new ACL graft for ACL tears. And again, an article on the effects of exercise on mental health would be much more applicable to primary care sports medicine versus the other two. And again, a very subjective component on this 10%. So some changes and improvements from 2022 to this year 2023's project. We went from 32 to 35 new members. We subtracted 2 journals, as I previously mentioned, due to low yield, and we added 3 new keyword hot topic searches. So let's look at our results for this year. So this just shows the total articles that we pulled for the first 3 years. You can see in 2020, 43 core journal articles and 28 keywords. We drastically increased that in 2021. In 2022, we went all the way up to 375 articles that we reviewed, 159 core and 216 keyword. This year, we actually pulled 164 core journal articles and 117 keyword hot topic for a total of 281 total articles. Now we had 6 individuals review each of those articles. So that was a total of 1,686 reviews of people reading and rating those articles. So again, you can see how this year stacked up to previous years. So it was the most core journal articles that we've ever pulled. The ratings for this year, the highest rated article was rated almost 80 points out of a possible 100. The lowest rated article was down at 29.16. The average article rating was a little under 60 at 59.89, and the standard deviation was 9.36. So then once we had those 281 articles, we came up with how many articles were we going to re-review? And this would be assigning another 6 distinct individuals to independently read and rate those top articles. So in looking at which articles we re-reviewed in 2020 and 2022, in 2020, we did the top 20%, which was just the top 14 articles. 2021, the top 25%, which was 35 articles. 2022, we did the top 10%, which was 39 distinct articles. So this year, we discussed as a group and decided to re-review the top 15%, which ended up being 43 total articles. So again, this ended up being every article that was rated a 70 or higher. So well over 1 standard deviation above the mean. And again, we had 6 different re-reviewers, the same as we did last year. So that meant every article that was ranked in the top 15%, that top 43 articles, was read and ranked by 12 different members of our committee. So again, this is what we re-reviewed this year. So our final cutoff articles we selected out of those top 43, our top articles, we chose 10, and then we chose 6 honorable mention articles that came from those top 15%, that top 43 articles. So this year we'll be revealing our final list of top articles from those 43 articles. And again, 10 articles we were ranked 1 through 10, and then 6 honorable mention. So I would like to put a plug in for session 16 on Wednesday, April 17th, where 3 of our members, Dr. Maura Davenport, Dr. Jason Deck, and Dr. Emily Eshelman, will be part of the group presenting the top articles 10 to 1 with this year an amazing panel of experts that will discuss implementation and practical application. And that group session will be moderated by Dr. Sam Dixit and Dr. Melody Hubris. So again, just a great session. It's a plug-in for people to turn in and to attend to that session on the last day in the morning, that's session 16. So without further ado, I'm going to turn things over to my co-chair, Dr. Bob Baker, and he's going to end up reviewing and discussing those 6 honorable mention articles that were selected for sports and exercise medicine for 2023.
Thanks, Lee, for that review of the process regarding the top article committee work. And I have the pleasure of presenting the honorable mention articles for this year, of which, as Lee mentioned, we have 6 different articles. And those articles, in no particular order, are article by Batista, and this is a performance and treatment article looking at cold water immersion and muscle soreness, systematic review. And next is MESIS and a daytime napping article, once again, another systematic review and meta-analysis of randomized controlled trials. And then finally, in this group, Kumar, a delayed timing of physical therapy and use of opioids and evaluation essentially of a chronic pain based on a cohort study that looked at a insurance database. The next 3 are Alatar out of Sports Health, one of our core journals, with the effectiveness of injury prevention programs for hamstrings, including core muscle strengthening programs. This was, again, a systematic review and meta-analysis. Kursad was one original study performed looking at accelerometer derived physical activity of the weekend warrior and incidence of cardiovascular disease. And then finally, Albright out of arthroscopy study looking at, once again, insurance claims data regarding vitamin D deficiency and rate of anterior cruciate ligament tears, as well as reconstruction failure. So the first article I'll review is the Batista article looking at cold water immersion and primarily muscle soreness. This is an updated systematic review. This was based on a previous study that was performed with a limited number of review of randomized control studies. This review included 44. The updated from 2015 only included 9 studies. There was an analysis of bias performed, and results show that cold water immersion improved muscle soreness relief over the control. This was irrespective of water temperature and protocol. Short-term and medium immersions had a positive effect. And immediate effects were seen only after endurance exercise, whereas delayed effects were seen both after endurance as well as resistance exercises. The type of exercise and emergent time could influence the effect, and applications longer than 16 minutes did not seem to have the same positive effects. Applications after a localized exercise did not differ from control and for immediate effects. And here's the forest plot from that article looking at severe cold. 5 to 9 degrees is what they had separated out here. Forest plot shows summation of these articles with favoring the effect of cold water immersion. And you can see the heterogeneity. This is looking at the moderate cold, another table pulled from that article. Moderate cold was defined as 10 to 15 degrees Celsius. Subtotal favoring the effect of cold water immersion. And then when those two were combined together, both moderate as well as the severe cold did favor cold water immersion for positive effects. So bottom line in this article, immediate effect only after endurance exercise and with up to 15 minutes of cold water immersion. Next article was by Masis, and it's looked at daytime napping. And this was a systematic review and meta-analysis as well. This was a study with a review of 22 randomized controlled studies, primarily normal sleep or partial sleep deprivation. Only 6 articles looked at partial sleep deprivation, though. Risk of bias was assessed by the Cochrane's collaboration tool and represented 291 randomized individuals. Normal sleep or partial sleep deprivation was the primary group studied here. Daytime napping looked at various times. The most effective was between the 30 and less than 60 minutes of napping. And evaluations were summarized into 3 different groups: cognitive performance, which was determined by a variety of tests looking at cognitive performance, memory, and recall. Physical performance was evaluated by various performance factors, including endurance, physical strength, and overall performance. And perceived fatigue also was included, primarily evaluated in these studies with survey to the individuals. Evaluation of a post-lunch 1,400 hours napping time period did provide a supplemental effect for high improvement in physical performance, moderate improvement in cognitive performance, and then moderate improvements in perceived fatigue after sports activity. And once again, here's the forest plot table out of that article, looking at the 20-minute to 30-minute time period and the average of those individual studies, as well as the variability compared to the 40 to 60-minute time period. Same thing, average and variability. When these were all lumped together, though, you can see, that the forest plot shows favor towards napping in these individual in terms of overall performance. So bottom line, daytime napping in the setting of normal sleep or partial sleep deprivation, but not complete sleep deprivation, can be beneficial for improved performance and less perceived fatigue. Next article in the honorable mention is this article by Kumar of delayed timing of physical activity and initiation and increased use of opioid use in individuals with knee osteoarthritis. This was a cohort study based on insurance claims and outcomes regarding use of opioid, both chronic as well as new use. Data included over 67,000 individuals, once again, commercial and Medicare Advantage claims of insurance. Delayed PT initiation was compared to 1 month and associated with a higher risk of opioid use in knee osteoarthritis as a surrogate for pain control. This is a table out of that study that looked at timing across the top, less than a month from the time of diagnosis to referral for physical therapy, versus 1 to less than 3, versus 3 to less than 6 months, and then 6 to less than 9 months, and 9 months to 12 months. You can see the breakdown of those cohorts, and necessarily the the correlation with increased opioid use. So timing, the longer the delay, greater was the risk of future risk of opioid use at all or chronic opioid use. Implications, early referral to physical therapy of knee osteoarthritis. There's early initiation of care, more effective pain management, and reduced use and reliance on oral pain medications such as opioids. Here's a nice graph, once again, out of the article by Kumar that shows the associated use from starting at 1 month to that 3 month to that 6 months, 9 months time period. And you can see the increase correlation with the use of opioids, either for the first time or for chronic use of opioids. So bottom line, early referral to physical therapy following a diagnosis of knee osteoarthritis is associated with decreased opioid use and possibly improvement in pain management. Next article is the Alatar article, which reviews preventative programs for hamstring injury, looking at the inclusion of core muscle strength. And this, again, was a systematic review analysis. This included 5 randomized controlled studies, all that met inclusion criteria, involving both the incidence of hamstring injury as well as the use of core muscle strength exercises. This represented over 4,000 players, primarily exclusively soccer players, with 379,102 exposure hours amongst those player athletes. Actually, a randomized control trial, but many were clustered, providing randomization basically of teams rather than individual control randomization. An evaluation of bias and methodological quality was included in the analysis. Their findings: core muscle strength exercises incorporated in injury prevention programs for hamstrings reduce the susceptibility and risk of hamstring injuries, primarily in soccer players and primarily male soccer players. Also, use of core muscle strengthening exercises could be used for prevention and rehabilitation of soccer players. This is that force plot out of that article, looking at the 5 included research publications and favoring the use of core stabilization exercises over no core stabilization interventions. So bottom line, core muscle stabilization exercise incorporated with the usual hamstring exercises may protect from further hamstring injury. Secondarily, core muscle strength exercises can be used for both prevention as well as rehabilitation of soccer players. Next article was an original study out of JAMA looking at accelerometer-derived physical activity and the incidence of cardiovascular disease. This was a study actually performed in the UK and a prospective study on 89,573 individuals. 1 week of accelerometer-based physical activity was included to document level of activity and the weekend warrior. Weekend warrior was described as massing the physical activity over 1 or 2 days out of the week rather than distributed over the 7 days of the week. There was a lower risk of incidence of atrial fibrillation, myocardial infarction, heart disease or heart failure, and stroke in these individuals. Physical activity massed in 1 to 2 days had a similar lower risk of cardiovascular risk similar to those individuals that participated more distributed over the 5 to 7 days per week. So short, 1 to 2 days, moderate to vigorous exercise activity, as defined in the article as a weekend warrior type pattern, was beneficial. And once again, you can see the summation of the four outcomes, both with atrial fibrillation, and comparing the active WW would be the weekend warrior model versus active regular. Both show a similar decrease in average incidence and decreased from the inactive population. Next, myocardial infarction, same thing. Both the active weekend warrior pattern as well as the regular distributed over 5 to 7 days per week showed evidence of decreased average incidence compared to the inactive individuals. Next, heart failure, same thing. Active weekend warrior type pattern, as well as regular and distributed over the 5 to 7 days during the week, showed a similar decrease in incidence compared to the inactive population. And then finally, same behavior here with stroke and active weekend warrior and regular distributed activity compared to inactive. So all four parameters showed a decrease in relative incidence compared to the inactive population, both for those individuals that masked their activity over 1 to 2 days versus those that distributed activity over the entire week. So bottom line, short or masked physical activity is as beneficial as regular distributed physical activity across several levels of time. And they looked at varying levels of actual time of activity, anywhere from 115 to 403 minutes, which included the usual recommended guidelines from current guidelines from the CDC and American College of Sports Medicine of 150 minutes per week. Our next is the Albright article looking at vitamin D and vitamin D deficiency and increased rate of anterior cruciate ligament tears, as well as reconstruction failure. This was a study, once again, that looked at insurance claims data, retrospective match cohort design, deriving information from the Pearl Diver claims database, and hypovitaminosis D was recorded in the claims data and represented 328,011 individuals. There was a significant increase in rate of index ACL tears, with 81% increase within 2 years of the diagnosis of hypovitaminosis D. Significant increase in rate of ACL tear revisions, with 28% within the last 2 years. And here's the nice table looking at the data that they presented, and looking at overall significant at the P level there for overall incidence compared to the control. Vitamin D deficiency was elevated. And this occurred in most age groups, with the exceptions of the 10 to 25-year-olds in both the male and female. So bottom line, increased odds ratio of musculoskeletal injury in both ACL and ACL revisions associated with vitamin D deficiency. And those are the articles for the year. And honorable mentions, please attend the session 16, as Lee mentioned, and hear about the top 10 articles as they are presented.
Those were great, Bob. Thank you so much, everyone, for tuning in. And if you have any questions or you want to get involved, just email me. You can see my email address here on the slide. And we look forward to seeing everyone at the conference in Baltimore. So thank you very much.